A 22-year-old man comes to the physician 2 weeks after undergoing successful arthroscopic repair on the torn medial collateral ligaments on his left knee. There is no complication. He is discharged on prescription of oxycodone and acetaminophen. He reports severe pain that prevents him from participating into physical therapy and wakes him from his sleep. He has a history of cocaine use. Physical examination of left knee shows healing incision. There is no joint effusion or erythema or evidence of wound dehiscence. His gait is normal. When physician recommends switching to ibuprofen for the pain, patient becomes visibly angry and demands a refill of oxycodone. Which of the following is most appropriate in this patient's request? So what should we do when patient is asking for opioid prescription? Are incorrect, and why is it invalid response to say to this patient's request? We should we prescribe the long acting opioid for better pain relief, as is willing to, if patient no, the pain contract, which is a pain contract, should be signed before giving any kind of opioids to the patient. We cannot sign the pain contract in the midway. It should be signed during prescription. And we should not give any kind of opioids until there is a severe pain, and we should first rule out the opioid misuse. This patient might be doing opioid misuse. Request and consent for urinary test to access the current drug. So this would be very unethical to do, as we can this would seem like patient is a drug addict or is just asking for opioid prescription. First, we should get the full information on which drug he is using and his about his substance abuse, because he was having a history of cocaine use. Should prescribe a short course of oxycodone and schedule the. We should refrain from prescribing any kind of opioid to this patient until we get an information about the any non-prescriptional opioid if the patient is taking. Referral to substance use counselor for addiction. It will be premature, because we should first see if the patient is really eligible for addiction counseling, and this should have contemplation, like patient should show a desire to go into the addiction counseling. Then only we can refer them to substance use counselor for the addiction counseling. We cannot prematurely decide on the patient's behalf for the addiction counseling. Patient should show contemplation to. In ethics, we have to remember we should not give any response that will look as a doctor, which will be very rude, or we should be very polite with the patient. And should first rule of ethics is try to get as much information about the patient as you can from the asking open-ended questions, or asking about the patient's drug routine, or if patient is not compliant with any drug, we should ask why patient is not taking certain drugs, and should be in the language that they understand. Okay, so let's go through explanation here. It's basically what are the best practices that should be followed by the physician while prescribing the opioid. So this all are the tables from UL. You have to, these are very important. First of all, prior to the initiation, we should screen the patient for risk of misuse. If the patient has history of substance use, like here in this patient, we should try at least to decrease the use of opioid in this patient, because they are probably going to misuse the opioids. Prior to initiation, we should perform an urine drug screen, and we should inform the patient about the PDMP, that is prescriptional drug monitoring program, that patient has to sign up to, and sign the controlled substance agreement, that patient should take one prescription from only one prescriber and can only obtain the opioids from only one pharmacy. So this is a contract, and in this contract there is also a certain criteria that if the patient lost a prescription, that cannot obtain a new prescription until and unless there is a new prescription. And the prescriber here in this agreement has the right to do urinary screen test anytime during the point of care. So this is a certain agreements that patient has to abide by if they want to start on opioid. During the therapy, there should be follow-up every 1 to 2 months. We have to check PDMP database before every refill if the patient is complying with this database or is not misusing the drug. You can perform a random blood urine drug screening. Okay. Opioid accounts for 3/4 of the all fatal prescription overdose. So remember, the opioid prescription are very deadly. Opioid misuse is defined as taking medication in a way that deviates from the manner. It's like overuse or deviation and purpose which for it was prescribing. So this patient start taking opioids that was given for musculoskeletal pain to decrease the anxiety, so that will be opioid misuse. Obtaining the opioid from multiple prescriber or taking a non-prescribed opioids or concurrently using any recreational drug or any non-prescribed controlled substances can constitute a misuse. So if the patient is taking this behaving this kind, so it's a opioid misuse. PDMP is a helpful tool for detecting the misuse. The state specific, so every state has PDMP database that records the prescribed controlled substances and that patient obtained, including the quantity, dates, and prescriber information. PDMP can identify patients who have been receiving opioids from multiple prescribers and suggesting to possible overuse or deviation. So what should we do in this patient if there is an acute pain management with opioid use disorder? We have to first set an environment, like we should be supportive, non-judgmental, and share a decision making with the patient. If the patient is having withdrawal, we can decrease the withdrawal by giving maintenance opioid like methadone or bupropion. For analgesia, for the pain management, we can maximize the non-opioid prescription like acetaminophen or NSAID, or we can use regional anesthesia whenever possible. Use of opioid only as needed based on decision share making is sustained remission. If the patient has been not taking any other opioids, should be on maintenance, may require higher dose, and use for the shortest period like 3 to 5 days.
Thanks for watching. Please give a thumbs up and subscribe for more.